Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you once again for having me on the program.
Yes, sir. Could we begin with a quick update with some of the outlying regions? We start in Region 5. What has been happening? We haven't checked in.
Well, Region 5, we have a doctor who is now there in the community, along with some additional medical staff, and they've been working with the community. To date, we have 9 active cases in Maracabai. We would have seen over the last couple of days, we have discharged about 84 persons because they would have met the minimum 10 days in self-isolation. So 84 persons were discharged, and we'll continue to test and monitor the other persons in the community.
Have persons been adhering to the curfew? The curfew.
Well, we continue to monitor. There are people who adhere and there are others who don't. So we'll have to continue to monitor and try to educate people as to the necessity of this.
All right, and over in Region 6, how has it been going there? And followed by 7 and 8 as well.
Region 6, we have a spike, as I told you earlier in the week, in New Amsterdam. And that's something that we have been working on, and we've been doing contact tracing. We have 36 persons who have tested positive in New Amsterdam. In the other regions, we have been looking at Warramadong because we've had a number of cases there. And again, we continue to monitor. We have a medical team in the community. There's a resident doctor there, and we have added some additional personnel where they can continue doing testing and assisting the doctor who is on site there. We have also been looking at St. Cuthbert's. We have had a number of cases in St. Cuthbert's. Currently there are 20 cases that right now we are monitoring. And today a health team is going to go in to do an additional appraisal of the situation there to see what are the driving factors causing us to get these new cases. And after that assessment, we'll be in a better position to take some additional measures.
All right. If I can ask you, I know you spoke of Warramadong, and that's the Upper Mazaruni area. If we're in the rainy season, how has the team been able to access some of these communities?
That does not pose a major problem for us. We have people who would go into the communities and work with them. Once we know that there are issues, we'll send the medical team in and they'll go in. But, you know, this thing, it's not just a medical response. We have to get persons who are in positions of influence, whether they're a Tusha or a village councillor or an NDC chairman or councillors in an NDC. The persons who are in positions of leadership and positions of influence, like community leaders, religious leaders, these persons can really help us by helping to spread the education pertaining to COVID, model the best practices of COVID, meaning to wear masks and sanitize and keeping social distance, reinforce the messaging that we have coming out from the national level, and help us to get that message across, because the Ministry of Health alone, or the task force, cannot do all of the education work that is necessary. What we have to do is to multiply this work, multiply the effects by getting more people to help us. And I strongly believe that people within the community who understand how the disease is transmitted can help us to change the dynamics of the disease in the community. Because they live in the community, they understand how people react and so forth, and they would know how to help us there. But we need that sort of assistance. You can't wait until you get a spike and then, we'll go in with a rapid response team, but we need to be constantly vigilant until we are able to get vaccines and so forth. So this is an ongoing effort, and we want to encourage community leaders across the country to work with us to spread the message and to get people to,
do what they're supposed to do.
exactly.
I know last year when we had spoken, you had made a similar call, and you said material was available, training also was available, so that those persons can go back to their community as well.
Yeah, we can provide the information if that's necessary, but again, we need people at the local level to assist us. In terms of an incubation period, from the time a person is exposed, they'll have about 14 days in which they can manifest signs and symptoms or show signs of infection. On average, while you have this 14-day period, we normally would see people within day 4, day 5 actually showing signs or symptoms of the disease. But then we also know that there are lots of people who would get infected and would not have any signs or symptoms of the disease. So they're positive, and if you do a PCR test on them, they will show positive, but they really don't have any signs or symptoms. So from the time you're exposed, you have the 14-day period, which would be the period, the incubation period in which this disease can develop. Once disease develops, we normally would look at disease being a mild form of it, disease being maybe moderate, then you have severe forms of disease. In most cases of severe disease would be people who would come to the hospital, and then we have a critical period. So those who are hospitalized, a subset of them would go into the ICU because they're in a critical condition. So you have that type of progression, and we're able to identify persons based on their symptomology, which category they'll be placed in. Persons who are asymptomatic obviously wouldn't have any symptoms. Persons with mild symptoms would mimic something like a flu. They'll probably get some fever, headache, muscle ache. In some cases, people would lose their sense of taste, sense of smell, and these are all typical signs of COVID. They can happen in other viruses, but because COVID is the one right now circulating, once we see these things, it would help us to then go and do a test and probably be able to identify COVID-19. Those who, and the person might have a cough. When it's mild, they might have a dry cough. In some cases, other persons might have runny nose. There is a subset of people who would present with diarrhea, so that's also possible. And then if the persons start having deterioration in their breathing, meaning they're having difficulty to breathe, then most of those persons would come to the hospital. And we'll assess them. In cases where they need hospitalization, we'll hospitalize them. And if they need support to assist them with their breathing, then we'll provide that, provide oxygen, provide the breathing apparatus if that's necessary, and so forth, and start them on some specific treatment. Okay. So that's what is happening, and the incubation period, the mean time, the average time would be about 4 to 5 days.
People usually believe once you, and in this particular case, as we're talking about COVID-19, once you get it and don't have a vaccine yet, and we understand that, but you feel better or it's being managed, that you wouldn't catch it, or it's not that severe?
Yeah, I think there are two things that people, ought to think about. One is that if you get COVID-19, there are some people who would be lucky enough that they get it and they would resolve. I mean, they wouldn't get any major signs or symptoms, and they get better. There are some people who would get extremely sick, and then even after they recovered and they're discharged from the hospital, for the next sometimes 3 months, 4 months, and longer, they would continue to have different signs and symptoms because the virus would have disrupted various organs in the body. So, for example, the COVID-19 infection can affect your brain. It can affect your digestive system. It, of course, affects your respiratory system. It affects your kidney. It affects your skin. So there are multiple organs in the body that this virus affects. And depending on how severe it is, people would have symptoms that last beyond when you were hospitalized. A typical example we have seen with some COVID patients is the effect that it has on the heart, because we have seen that it can cause arrhythmia, meaning a disruption of the beat of the heart, and it can also mimic heart attacks and so forth. So this virus, apart from when you're in that critical phase in the hospital, once you recover and you're discharged, you can end up with something that is called long COVID, where other organs of the body can be affected. So this is something that people have to bear in mind. They also have cases where people who would have had mild COVID, so these are younger people, they probably get infected, not much happened to them, they feel better, but then a couple months after, they start exhibiting symptoms of heart problems and other conditions. So long COVID is also an issue, and we have to think about that as well. And then you also have a category of persons who, when they get infected, they get better, but they can also get reinfected. And we have seen that with this virus, it's possible to get reinfections. So not because you got COVID, that means that everything is fine. If you got COVID, you probably will develop some level of immunity, but there's still a possibility, because based on the reinfections and so forth that we have seen, that people can get reinfected. So it's something, that's why we need to wear masks and still protect ourselves.
All right. In terms of the increases that we would have had, and we have about 52 active cases, I believe, or no, new cases, sorry. Do you have statistics to show the particular age group or gender as to who's being infected or reinfected in this case?
In terms of those who have been infected, we do have a breakdown by age, and we do have a breakdown by sex or gender. So we have that information, that's not a problem. In terms of persons with possible reinfection, meaning that we've seen them already in the epidemic and now they're testing back positive again, we have been investigating that as well. So that information, we've started working on it, collecting it, studying it. And like with everywhere else, this is an ongoing process to understand what is happening.
And of course, this information with the breakdown is available on the ministry's website. The dashboard is made available every day. All right, Minister, thank you so much. We have a few questions from the Guyana Chronicle as well. And they're asking, they said, They saw that CARFA sequencing detect that the UK variant is in Trinidad, and they want to know, have COVID samples from Guyana been sent to CARFA for the same sequencing? And yes, if yes, has there been any update on that end? If no, well, when the samples will be sent?
Well, CARFA has been, as I've said before, has been doing some amount of genetic sequencing, and that would tell you whether or not it's one variant or the other.
Okay.
And yesterday, the Ministry of Health in Trinidad and Tobago reported that they have identified the B117 variant in Trinidad. So, they have reported that, and so we are now alerted. This probably is the second case that we've had in the Caribbean, the first being in Jamaica. Now we have one in Trinidad. And I suspect once we start doing more genetic sequencing, that we'll probably find similar cases in other countries. We have sent some samples to CARFA during this week, and we'll await the results from them.
Okay.
These things take some time to do and interpret, so we'll await the results from them.
Yes, Minister. So the third question, the Jamaican virologist, Dr. Joshua Nzinga, recently told the Guyana Chronicle that existing health guidelines, wearing a mask and sanitizing would suffice amidst the new strains, and they're asking your take on that.
Well, he's correct, because the transmission is the same. That is, it's through droplets or aerosols, and therefore if you wear a mask to protect your nose and mouth, then you prevent that transmission. So nothing has changed in terms of transmission dynamic, meaning that once you have that barrier. In terms of the speed of transmission, the newer variants in some cases have been shown to transmit faster, and that's what we have to look out for.
All right. Just bear with me with the last one. It might be a little bit of a stretch, but they're asking, should it be proven that the current vaccines are less effective on immunizing against the Brazilian strain? How would Guyana navigate the situation, particularly cognizant of the country's proximity to Brazil and the challenges with policing the borders in Region 9?
Well, so far, none of the strains, the vaccines that are currently being used, like the Pfizer vaccine, has been proven to be effective against the different strains. They have done the tests last week, and they have scientific evidence that the vaccine works. So we don't have to get into hypotheticals when they have already checked this and have been able to say conclusively that these vaccines are still working against the current strains that we have. What we know is that the virus is going to continue to evolve. There are probably about one mutation every 2 weeks. And most of these mutations are of no significance. Some of them, however, are going to change how the virus transmits, how it becomes more severe, or in some cases it will become weaker. So as the virus mutates and evolve, we'll have to constantly do those sequencing and then compare it to see what is effective and what is not effective. But with the vaccine that is out, like for example the Pfizer BioNTech vaccine, they actually did run some tests, and they have said that the vaccine is still effective.
All right, and we spoke about the policing aspect a few days ago in Region 9.
Yeah, we continue. We have our borders. It's closed, and we continue to monitor people coming in or going out.
All right. Minister Anthony, thank you so much for speaking with us today.
Thank you.
Well, that's it for today's COVID-19 update. We just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, follow us on social media for regular updates.